Yeah, I started Titanium Healthcare because I saw that my own family couldn't get the help they needed when they were hospitalized. My stepdad was in the hospital and he had major medical conditions, and he left the hospital without really a clear understanding of his medicines, his plan of care, a follow-up visit with his doctor. And I just thought, there's got to be a better way. We're this big, powerful country, and yet so many people don't get the health care that they really need. So Titanium was really built around the idea that we would just help people stay home, stay out of the hospital. The Titanium model works, and one of the major statistics that we tried to fix was 1 in 5 people are readmitted within 30 days nationally. So for everybody who's in a hospital, 1 in 5 is going to be readmitted in 30 days for some reason. And that, for me, is a statement about how the system really fails to support people who leave the hospital. Titanium patients are less than 5%. So less than 5% of our patients are readmitted within 30 days, and they're really sick people. So we take great pride in that statistic because it really shows the power of the model. Patients love it. And this is the one that I was really most delighted with, because our feedback is exceptional. One of the facets of our model is that the physician is allotted 45 minutes to spend with a patient. 45 minutes of physician time where all the medical history is reviewed, the plan of care is reviewed, medicines are reconciled, and typically we'll run into people in our clinic who are taking blood pressure meds that they got from their cardiologist, from their hospitalization, from their primary care. They're taking all three. They don't even know. Because nobody sat with them and really explained what it was. And so our patient satisfaction is over 99%. Clinics aren't the only business at Titanium, because there was a natural need for us to expand our services. We started with clinics focused in on multiple chronic condition patients, but we realized that physician services were one side, but non-physician services were a massive other side. And so people's access to food, housing, transportation, medical equipment, those challenges were also there and influencing their success in the healthcare system. So for that reason, we naturally expanded our service offerings to be care coordination and the physician practice. I came up with the name Titanium because, well, this is probably not a natural progression, but I started my career on a nuclear submarine. And I was used to breaking up big problems into little pieces, and so I kept going back to atomic fixes adding up to a major resolution. And so we went to the periodic table and named it Titanium because we wanted to break that big problem in healthcare into little fixable pieces and correct it one step at a time. Titanium Extra Clinics is an offshoot of the Titanium brand, because we realized that with these clinics we wanted to make sure that people felt that they were getting extra care. And we looked at some of the names, and there were abbreviations of the IOC and the DC3 and different abbreviations, and what we really wanted people to associate with Titanium was this extra clinical support for people who needed extra care. And so for patients who have multiple chronic conditions, they get extra because they need extra in order to help them succeed at home.